Chinese medicine has been for me the fulfillment of a search for a congenial system of healing. It is a personal, subtle, gentle, yet highly technical medical system which allows me to be close to the essence, to the life force, both of my own and that of others. It's a masterpiece of harmony, intricacy, and movement, which never ceases to engage me, never ceases to fascinate me and intrigue me. Well, I wrote a book about how you relate to your patients. You call it, patient, practitioner, blah, blah, blah. And I wrote down here something, from that book of what the important things are in terms of making the kind of relationship that I made with this woman, that I made with another patient, in which you have that kind of impact. And the most important single thing is respect. And what you need to respect more than anything else in somebody you're working with, as I once said to one of our students who asked me that, the difficult patient didn't choose you to torture. You were chosen to heal whatever makes that person difficult. So what you need to look for in every person that you work with is the positive. You want to find what they're doing, even in the midst of everything that's going wrong. They're doing something right. And it's important to find that, to see it, because all those young people that I was talking about, who were so lost in the 60s, nobody ever really listened to them and what was coming from them. Nobody ever saw them for who they really were, because that would have been difficult and created problems for the parents. Because what they would have seen are troubled people who are growing and are lost. So anybody who survives develops some method of surviving. And that method usually has something positive in it. And it's important for you to try and identify what that is. And it will come out in their relationship with you. I give this example because I can't think of anything else, but when I was working, I would have patients come in, and if I answered the phone while they were there, let's say I was upset that day, and it showed on my face, or in the tone of my voice, or how I answered the phone, or how I greeted them that day, or my body, language. And they would always almost interpret it as that I was upset with them. And so, what I would have to tell them was that you're right, it's good. You saw that I was upset. Not everybody is that sensitive to what's happening in another person. That was something very positive about that particular person, that they could sense that I was not feeling good that day. I said, but the reason I'm not feeling good is because my son is sick, or my wife and I didn't get along well this morning, or I'm sick, or I've heard some other bad news, having absolutely nothing to do with you. So you picked up something in me that not very many people would be able to do, to see, to sense. That's very positive. It's just that interpreting it always in terms of yourself, that we know that's your problem. You're doing it all the time. You walk along the street and people look, cross-eyed at you, and you think it's something to do with you, right? Right. So you're, picking up whatever they were doing. That's a gift of theirs, and how they're abusing it, which creates a lot of problems for them in life, and which is why they're coming to see you. They're not happy. The most important thing is the fact that you listen. Being heard is what everybody wants. They want to be seen and heard for who they are. So that's the most important thing. People who are in the business of listening will never go out of business, because people will always want to be heard. And when you see a doctor for 5 minutes, the question is, how are you heard? And there, as I said, and when I was actually talking about touch, what I had discovered in my own evolution as a psychotherapist, as a doctor, was that the most important thing in healing is touch. And I think her name was Maya Angelou, the poet. She said that, people may not remember what you say, like all this talk, or even what you do, but they'll never forget how you made them feel. And that is touch. That's how you touch people. How are they touched? Very early in my career, I was in a psychoanalytic institute, and they had a clinic, and I was seeing patients there in order to see which way who would we refer them to. And a man came in his 50s, probably about 56 years of age, and he was extremely depressed. This is probably about 1960. He was very depressed, and so I asked him, something about himself. And what he told me was his work was that he was a furniture finisher. He upholstered furniture. That was his work. And that had been his father's work. And he grew up in the Depression. And he wanted to go to college. He was very interested in history, in philosophy, in theology. He wanted to study. But because they were having a great deal of difficulty earning a living, supporting the family in the Depression, which is what happened a great deal, he had to go to work with his father and become an upholsterer, and this is what he did. And now he had a family, and he had to support it, continue to support a family, but he still longed for all that was inside him that he wanted to know about. Knowledge, information, the education that he never got. And as I listened to him, even more than most of the people that I saw for all kinds of reasons, something in me almost became him. I mean, I felt exactly what he was feeling, that this could happen to me. Something that Thoreau called, most men live lives of quiet desperation and go to their grave with their song still inside. And I spontaneously began to cry. I didn't even know I was crying, but I was crying. I just had this extraordinary feeling for this particular man. And all I did was see him that one time. And then I referred him to somebody, but that was my job. He sent me a letter about a year later. And in that letter he said, "The day that I saw you, my depression went away." And he said, the reason it went away, and since that time, whatever my life has been, I've taken as it has come. He said, because I saw those tears in your eyes. So somehow, I had touched him. It wasn't anything I did or said, but somehow I just happened to have that kind of connection with that particular person. What he was feeling, I could feel or felt. It could happen to me, I guess. I don't know what was happening. But at any rate, he saw those tears. And that was all that really he needed. Somebody who really understood what was happening inside him. So, I guess that's what Angelo meant. But respect, which I guess somehow is inherent in what happened between us, is most important. Authenticity is very important, and that is that you're direct with people, that you don't attempt to manipulate them, that you're essentially honest with, I guess as I was with these patients who said I was angry at them or upset with them. I told them, I had an argument with my wife, not the last thing anybody ever heard of, or my son was sick. The ability to be objective, that is, to see what the patient is doing, even to you, as something that it involves them and not necessarily you, and how it affects us. To be objective about what it means to them. Confidentiality. Consistency. And I would think, from my point of view, most important of all, beside respect, is commitment. That person has to feel that you are listening to them because you want to listen, because you care, and that you're going to stick with them through whatever hard times there are that person has to go through. Because nothing ever positive ever happens without pain. And living with people through their pain is the most important thing that a doctor can give a patient. You're going to be there for them. You acknowledge their pain, that this is really difficult. This isn't easy to do. All those things I'm asking that lady to do, they're extremely difficult for her to do because she's used to a totally different life. But she's doing it. And I'm committed to seeing her through this. Boundaries are very important. This is in terms of how we touch people. Being ready for change. And incidentally, the commitment has to be a continuous one, because people will come to you with problems. You help them a little bit, they go away, they come back. You have to, that commitment has to be an ongoing commitment. So you have to be ready for them to make change. The change may be, I don't want to see you anymore. You know? That's something you have to deal with and accept in terms of your objectivity and your boundaries. Expectations. I always am amused by my colleagues who used to call me up and say, you know, would you like to have this patient? The patient doesn't have a self and I can't deal with them. So I would say, well, look, they're a patient. How can they have a self before they see you if that's what they're coming to see you about? You know, how can people meet the expectations of the doctor to perform, you know, necessarily even to come on time when that's what they can't do and that's why they need your help? So what you expect people to be able to do before they even have a chance to get some help is, you know, something to consider.